Hello, and thank you for tuning into week 5 of this educational series. This week, we're going to talk about child development. If you haven't seen the last 4 weeks of materials, we have already covered postpartum physical and mental health, NICU care, and child attachment. You can find all of those materials on our website, which I will have linked at the end of this slideshow. If you don't know me, my name is Grace. I'm a third-year occupational therapy student. I am a mom to a 1-year-old, and occupational therapy focuses on occupations. Occupations are the things that we want or need to do in a day that bring meaning to our lives. So, my favorite occupations are playing with my daughter, going on walks during sunset, and binge watching TV shows with my husband. If you're tuning in on our YouTube channel, I would greatly appreciate if you're willing to take this pre-survey. It is anonymous, it's fairly brief. It just helps me understand how to improve my sessions going forward. These are the topics that we're going to cover during today's session. So let's jump in. So, I just want to preface as we talk about development that developmental milestones, which are what we're going to talk about today, are generally categorized as things that most children, so most being 75% or more children, can do by a certain age. So, we're going to talk about a lot of things of child should be doing this by this time and this by this time, and that is categorized as 75% of children are generally doing that. Your child could be in the 25% that doesn't do it until 2 months later. So, if you have concerns for your child's development, bring them up to your doctor. They can talk about like a referral to get an OT, speech eval going forward. But don't stress too much. Some kiddos don't meet milestones until a little bit after other kiddos. So, we're going to start just from the very beginning in the newborn stage. The newborn stage generally lasts from birth until 8 weeks old. And in those first 8 weeks, we start to see baby's motor movements slowly become more controlled. Now, they're not quite as controlled as a toddler's would be, but they are still slowly moving from jerky to a more smooth pattern. At this time, babies do still have very limited neck control, so it's important that you support their neck when you're picking them up and holding them. And we also start to see their little hands in balls. So they're really tight fists, and they don't seem to want to open them. That is developmentally appropriate, so don't stress too much about that. At this stage, a baby can hear but does not understand what sounds mean. And they will begin to, over the course of the 8 weeks, progress to responding to familiar sounds. So when they hear your voice, they might turn their head that direction. In this first 8 weeks, their vision is also developing significantly. So research shows that newborns can actually use their peripheral vision a little bit better than their central vision. The central vision is still very blurry and developing at this stage. So using things like large and bright contrasting colors are generally easier for baby to see at this stage. So things like the black and white contrast books or black and white contrast cards are really fun for baby in this stage. In terms of communication, babies primarily communicate with crying. So they will start to take in information about how their primary caregivers are responding to their cries, and they will begin to understand whether their care is consistent and nurturing or if it's rough and inconsistent. Some activities that you can do to promote your newborn's development includes holding your baby. This helps build your baby's bond with you, and it promotes brain development. Talk to your baby. This includes changing the tone of your voice and doing facial expressions. I know we said that babies can't see much, but getting into that habit early allows you to continue that as they continue to develop, and just showing them the different range of emotions early on never hurts. Play with your baby. At this stage, this can look very vague or to some people, maybe even boring. But like I said, providing your baby some contrast books to look at while they're laying on their tummy. Um, this can do wonders for their development, or you can lay there and shake a toy at them. They can't see much, but you're still engaging with them and you're still building that bond. And finally, tummy time. So, tummy time can begin from the time a baby is born. This is going to help them strengthen their neck, core, and back muscles that they're going to need for more advanced motor skills like crawling, walking, sitting up. This does not always need to be done flat on the floor. So it can also be done laying on your chest. So if you're laying flat on your back and you put baby on your chest, that still allows them the chance to work against gravity to build those muscles. Some infants do not like tummy time and they will get very fussy. So just know that it does not need to be a 30-minute long tummy time session. You can keep them short and frequent sessions to allow for them to still work on that skill while taking care of them when they cry. But tummy time is very important for ensuring baby develops their motor and their sensory systems that they need later on. All of these milestones that I am including in this PowerPoint are from the CDC website. And so I took it directly from there, and I'm just going to cover just a few of each. I don't want to go too in depth. These slides will be on my website, which again, I'll have linked at the end of this presentation. But if it's something that feels really intimidating for you and you just feel like you can't keep track of it all, that's okay. Everybody feels that way. The CDC does make a milestone tracker. And so you put in your baby's age, and then right before their well visit, it'll ask where they're at in meeting their milestones. And I personally really like this milestone tracker. I used it for my daughter because it also includes like videos and pictures of what the milestone looks like. So if you're not sure if your baby's doing that, there's kind of a reference. And then in terms of deciding, yes, my baby's doing that, no, they don't, it has 3 options. So it has yes, no, and not sure. And then that way it gives you like a little summary so that you can go in to your baby's well visit and talk to your pediatrician about, are they on track developmentally? Do they need a referral to see a therapist? But at 2 months, we're going to start seeing baby become more aware of your interactions with them. They'll begin to smile when you talk to them, and when you pick them up, they'll calm down much easier. They'll start to make sounds other than crying, and they'll start to respond towards more loud sounds. And so some babies might cry to loud sounds, some babies might turn their head toward loud sounds, but they should be responding towards those loud sounds. At this stage, they'll start watching you or a toy as you move, so they may not keep their eyes stuck on you for as long as you're walking across the room, but they'll watch you very briefly as you move, or if you approach them to pick them up, they should be watching you, making eye contact with you. And then at this stage, when they're on their tummy, they're going to start holding their head up. This is going to be very brief. They're not going to be like holding it up for a really long time, but they're going to start picking it up, and that's going to be building those muscles in their neck. And then this is where we start to see their hands open a little bit more and be less tight. To promote development at this stage, you want to really start talking to your baby. So it's going to sound silly, but describe the things that are going on around you when you're out on a walk. Read to your baby. Talk back to your baby when they make those little sounds at you, or sing to your baby. All of these are really important for developing those cognitive skills as well as the speech skills that come with that. And it is important to continue with tummy time. This will continue to strengthen those motor and sensory systems that they need later on. And then just continue to give your baby toys to look at while they're in tummy time. I attached a picture of contrast books. I think these ones are really Really fun for kiddos at a young stage. Also, those little like crinkly books can be good as well if you put that right in front of baby while they're laying on the floor. At 4 months, we see babies starting to do little chuckles. So it's not a full belly laugh yet, but they're getting there. We see them start to look for your attention. So they might smile to try to get your attention, or they're going to start making coo sounds at this point to get your attention. They begin demonstrating hunger by opening their mouth when they see the breast or the bottle, and they start to become aware of their hands. So they'll start looking at their hands for longer periods of time. And the physical development at this stage is very significant. Their head is going to become more stable when you hold them. So you still want to provide that support, but they're not quite as floppy as a newborn would be. And if you put a toy in their hand, they're going to hold on to that toy and hopefully attempt to bring it to their mouth. And then when they're on their tummy, they're going to start pushing onto their forearms. So not with their arms straight, but with their arms at a 90-degree angle, they should be up on those forearms. At this stage, you should continue positively responding to your baby. So again, like things through singing and talking with different tones of voice and facial expressions. Provide them safe opportunities to lay on the floor and explore the toys around them. At this stage, baby isn't mobile, so if you can provide them that safe environment, they shouldn't be going anywhere, and this is a great stage to really just capitalize on floor time. You can play with their hands and feet to promote exploration of those body parts. So you can do patty cake, you can do this little piggy, and while they won't understand quite yet, you're still making them aware of the different parts of their body. You can move toys back and forth in front of their face to allow them to practice those visual tracking skills. So just back and forth and up and down in front of their face, and just watch how they do tracking that toy. Um, and then using a mirror at this stage is really fun, and you can practice like different facial expressions. This is going to help baby become more aware of who they are. And those facial expressions are definitely something that come in down the line in development when they're starting to learn emotions and build those social friendships with others. They use that understanding of the different facial expressions to understand how someone's feeling. At 6 months, you're going to start to see baby laugh, actual laughs, not just the chuckles. And a lot of times they like to look at themselves in the mirror at this point. They'll start to recognize familiar people. And when you talk to them, they will take turn making sounds with you. And they're going to start blowing raspberries with their tongue. This is a very fun stage. They will start to reach for toys that they want and they'll bring them to their mouth. At this stage, everything pretty much goes to the mouth all the time. They'll start to roll from tummy to back. So the reason I make the distinction of tummy to back is because this is the easier way for babies to roll. It's very common for this to be the first direction. Just because they can roll this way does not mean that they can roll back the other direction. When rolling from tummy to back, gravity is really kind of helping pull them up over that arm to land them on their back. But when they're trying to go the other direction, from back to tummy, they're working against gravity, and that takes a lot of core strength. So a lot of times we see that tummy to back first. But like I said, this is what's typical development for about 75% of kids. My daughter did the opposite. She rolled back to tummy first and then tummy to back. So it's not to say that it is a guarantee that your baby will roll one way first. When they're on their tummy in this stage, baby's going to start pushing up on their hands. So you can see in this picture on the left, on the bottom, the little boy, he's pushing up through his arms on his using his hands. And then the little girl at the top, she's kind of in this tripod sit. So at 6 months, they'll typically lean on their hands to support themselves while sitting. They are still pretty wobbly, so it's not abnormal for them to tip over still at this stage. So definitely provide a safe space for them to practice this skill. To promote development at this stage, you want to continue doing that back and forth interaction with play and communication. So when your baby smiles, you smile. When they make sounds, copy them. This helps them learn those social skills and that reciprocal communication. Continue to narrate and explain things as you do them. Again, this is just going to help your baby's language and communication just blossom. You can give your baby a container with objects so that they can practice putting things in and taking them out. You can work on sitting by putting toys in front of them and just be there for assistance. Like I said, they're still kind of wobbly. Providing toys of different textures for baby that are safe for baby to chew on are really important. Like I said, everything goes to the mouth at this stage. But allowing them to explore different textures is really important for developing their sensory systems. And then when in tummy time, offer baby a toy that's just slightly to the side or just slightly in front of them to promote them to want to move and reach for that toy. At 9 months old, this is often when babies start showing signs of stranger danger, so they become much more clingy to you and shy around strangers. They'll start to show a variety of facial expressions like happiness, sadness, or anger. So, this is where those many months of working on facial expressions, showing them your different facial expressions, really starts to play in. They'll respond to their name by looking at you when you call them. They'll start doing babbling, so that's where we hear like the ma or the ba. They will start banging two toys together. So typically that looks like what we're looking for there generally is that they're banging two toys together at their midline, so in the middle of their body. If they are holding a toy to their right and bringing their left hand over to bang, or vice versa, and they don't bang in the middle, that could be something you bring up to your pediatrician to talk about a referral to OTPT, because they're not really wanting to bring things to that midline, and that is pretty important for other developmental skills later. At this stage, they're going to start sitting without support. They might still tip over depending on the baby. It does happen. And then one thing that was recently changed on the CDC developmental milestones list that I think is still important to have is crawling. Crawling typically develops between 7 to 10 months of age, and it's really, really important for developing that upper body, core, leg strength, as well as the sensory systems. It puts their head in a different area and space, and so developing their vestibular system. Through calling, they're using a lot of muscles, so it develops their proprioceptive sensory system. We are going to talk about sensory processing next week, so if you want to tune in and learn a little bit more about sensory, that will be next week. But this is typically around that 7 to 10 months, and the CDC took this off of their list, which I think it is still very important to be aware of. So at the 9-month stage, then, your baby may be just starting to attempt to crawl, or they may have mastered the skill already. That's the thing about milestones is we say by this age, 75% of children are doing this, but there really is a range from when these start to emerge to when they're mastered. Promoting development at this stage includes continuing to repeat your baby's sounds and verbally engage with them. You can read them books, sing with them. When putting them on the floor for playtime, put their toys just slightly out of reach to encourage them to try that crawl or to roll to them as well. You can begin showing them how to wave bye-bye and shaking your head yes or no in response to questions. Babies like peekaboo at this stage, so playing peekaboo with them to help them develop object permanence. Object permanence is that understanding that objects are still there even when you cannot see them. So if you were to put something under a blanket, baby might not understand that item is still there, and you can help them develop that by games like peekaboo or hiding things under blankets and helping them find them. And then you can encourage toy exploration by doing things like building up items and having them knock them down. I included a image here of a baby playing with squigs. So helping them learn how to get into like that kneel position to play with those squigs. That works on those fine motor skills too. So lots of activities. At 12 months, baby will really start enjoying games like pat a cake. They'll start waving bye bye and they will call out for mama or dada. They understand the word no, although they may not listen to it. And at this age, they'll begin looking for toys that you hide under a blanket, or when you play peekaboo, they'll look for you. This is demonstrating that development of object permanence that we just talked about. They will start to use toys and furniture to begin to pull themselves to stand. So you can see in the picture here on the slide, that's what that baby's getting ready to do. He's holding on to that little toy and that foot's touching the ground. He's getting ready to pull himself to stand. When they eat at this stage, they typically use what we call a pincer grasp. So that's picking up small food items between their thumb and index finger. And then at this point, children are typically crawling independently. So if your baby's not crawling at this point, definitely talk to your pediatrician and see if there is a need for a therapy referral. Sometimes, if baby's meeting all their other milestones and crawling is the only one that they didn't meet, then sometimes that can be up to your discretion on whether or not you think that therapy would be beneficial. I think sometimes it doesn't hurt to just get screened and see what a therapist thinks, whether or not therapy would be beneficial. But at this stage, this is where you kind of start teaching baby those quote wanted behaviors. So showing them what to do or how to respond to something and giving positive encouragement when they do it. So, for example, if they pull the dog's tail, you teach them to pet gently. And when they do it, you give them a hug. At this stage, you can build on your baby's language. So if they say wa, ask them if they want water. So kind of like finishing that word for them so that they kind of learn what that full word comes together to mean. You can continue working on stacking and knocking items down. Exploring sensory play is really fun at this age. So an easy, eat safe option that I like to do with my daughter is blending up some Cheerios in a blender. It puts it essentially into like a dust and then let your baby dig through it. You can put toys in there for them to play with. It just helps develop that tactile sensory system. What we have pictured here on the slide is a busy board. So things like boards with like zippers, strings, buttons, snaps. Baby won't know how to use them yet, and that's okay, but they're starting that early exploration to begin to understand those things. And then encourage role play. So show a baby what the right use for a toy is. So if you have a little toy hairbrush, start brushing your hair with it so that baby can see this is what you do with this item. Like I said, these are all from the CDC website, so there's a lot on here, but I'm just going to go through just a handful. So from 12 to 18 months, baby continues to go through many changes. When we look at developmental milestones, it's typically broke up by meeting milestones by 15 months and then by 18 months. So by 15 months, a child will begin clapping. So like I said earlier on, when they bang those two toys together, that's almost like a precursor for learning to clap. And that's why we look at doing that in that midline, because clapping is typically done in that midline. They'll start saying words outside of mama and dada. So they might say like da for dog or ba for ball. They'll begin using items and toys the correct way, the quote unquote correct way. So if you hand them a little phone, they'll put it up to their ear. And at this stage, a lot of babies might be taking small steps on their own or walking on their own. By 18 months, baby will begin helping with dressing tasks. So when you pull out a pair of pants, they might lift their little foot up. They'll start following one-step directions, something like, give me your toy, they'll hand it to you. And at this stage, they're typically walking without holding on to anyone. And then when eating, they're going to try to use a spoon. It's typically pretty messy, but they're going to try. And it's important that you let them try so that they can continue to work on building those skills. By 24 months, baby will notice when other people are upset and they may pause or look sad when someone's crying. So, there again is that working on facial expressions. This is where that really starts to come in. They will begin pointing to two body parts when you ask where they are. So, if you ask them where are their nose, they'll point to their nose. And where are their ears? They'll point to their ears. They will hold something in one hand while they're using the other hand for something. So, like an example would be if you hand them a little container with a twist lid, they'll hold the container with one hand and they'll try to twist the lid with the other. They may or may not get the lid off, and that's okay, but they're trying. And then they're going to start kicking a ball. It might not be the most efficient soccer kick you've ever seen, but this is where they're really going to start developing that. By 3 years old, baby's going to notice other children and join them in play. They'll begin talking well enough that others understand what they're saying most of the time. If this is something that you feel like your child struggles with, where they're talking a lot, but really most people are not understanding what they're saying, you can consult a speech therapist. They'll begin drawing circles when you show them how to. So, when developing those pre writing skills, circles are a pretty common start, and they're going to be able to imitate you doing that. And then they can start putting clothes on, like loose pants or jackets, on their own, and they'll start being better about using a fork at the dinner table. For promoting development at that 12 to 18 month stage, you want to allow baby to practice walking over different surfaces, and they can use like those little push walkers to help them. You can give them crayons to practice coloring. At this point, it'll just be a lot of scribbling, but still important to start working on that. And then engaging in pretend play, so taking care of a doll or a baby. For 18 to 24 months, you'll practice kicking a ball. So this might look like you helping them do that, but that's okay. Helps them develop those skills. You can sing familiar songs, use simple shape sorters. So that's what I have pictured down here at the bottom. And then encourage two-word phrases. So when baby says milk, try to encourage more milk. And then offering choices and waiting for a response is really important at this stage as well. And to promote development by 3 years, allow your child to climb on playground equipment, practice drawing lines and circles, and work on naming feelings and emotions, including describing how we know when someone's feeling a certain emotion. So, again, working on those facial expressions. And I attached a little book here, a fun little feeling monster book where you can talk about some of those things. By your 4 years old, children will begin to want to play with other kids more. They'll answer simple questions like, what is a coat for? They'll begin drawing a person with 3 or more body parts. So a lot of times at this stage, it's like a big circle and they've got a couple legs and a couple arms. So that's typically what it looks like. And then they'll start holding their crayon between their fingers and thumb rather than their full fist. By 5 years old, children will begin following simple rules during games. They can tell stories with 2 events. They can count to 10, and they'll start working on being able to button buttons. So to promote development, in this stage, you can provide simple puzzles for them to practice and matching games. I have some pictured in the top corner here. Allow them to practice cutting with scissors with adult supervision and assistance as needed. You can find like kid-safe scissors where they can't cut anything but paper. And when you're working on this with them, you want to try to encourage like appropriate scissor use. So that's with their elbow tucked in at their side and their thumb up. A lot of kids sometimes will want to put their arm all the way out and their scissors will be upside down. So try to work on doing it in the most appropriate way. This can help you reduce fatigue as they get older and continue working on those cutting skills. At this stage, you can also introduce cooperative games. So like I said, they follow simple game rules at this point. So I provided an age-appropriate example. So Hoot Owl Hoot is a cooperative game. All of my references will also be linked at the end of this slide where you could find the link for this, but I did just get it off the Walmart website. And at this stage, this is typically when children are starting to play in team and competitive sports. Adolescence is typically considered to be from age 10 to 19. So at this age, you can expect your child to start going through puberty, which will come with its own set of changing emotions and behaviors. There's typically an increase in the desire and need for independence, and this oftentimes come with an increase in responsibilities. So during this stage, kind of in the later of the stage, kids will start looking at getting a job, but they can also have household responsibilities as well. And then at this age, children become interested in advancing more of their social and romantic relationships. So they'll really start solidifying those friendships and may even start a little later in this phase looking at dating. So, like I said, occupational therapists focus on promoting an individual's participation in their occupations. Occupations are the things that we want or need to do in a day that bring meaning to our lives. So, for children, these occupations might look like play and dressing, interacting with others, so that social engagement, eating, sleeping. OTs receive significant education regarding child development because physical, emotional, and cognitive development all have a direct impact on our ability to participate in our daily activities. So, occupational therapists will work with children, particularly children experiencing developmental delays, to advance to age appropriate developmental skills. Like I've said several times throughout this presentation, if you have concerns about your child's development, consult your pediatrician and discuss the potential need for therapy services. A lot of places can do like a screening before they even evaluate your child to see if they think it's necessary that you receive services. This is the handout associated with this session, and again, it will be on our website. If you filled out that pre-survey, I would greatly appreciate the results from the post-survey as well. Same setup, it is anonymous, it's pretty brief, and it just helps me learn how to better work these sessions. That link there is to our website, so that bloomingbeginnings.my.canva.site. You can put that directly into your browser and it should take you right there. This QR code takes you to a list of local Cheyenne, Wyoming resources. So if you're considering the possibility of your child needing therapy services for development, there's a couple therapy places on there, like Teton Therapy, Sensational Kids, Stride. So go ahead and check those out. Like I said, next week we're going to cover sensory processing. And then this QR code will take you to my list of references where you can find where I got all this information, and like that Hoot Owl Hoot game is on there as well. Thanks so much for tuning in, and I hope that you enjoyed today's topic, and hopefully you'll tune in next week.